One of the most dangerous things a woman can do in Uganda is have a baby.
On average, we lose 16 to 20 mothers every day due to pregnancy-related complications. This is every day.
Those shocking statistics translate into 6,000 women lost every year in childbirth, a tragedy rarely seen in North America. As a matter of fact, Canada, with a similar population to Uganda, loses only about 35 to 50 women every year. The disparity is disturbing.
Now, most of these people are not dying because they need sophisticated interventions, which, can't happen. But sometimes they're dying because it's not news. Like, it's not news that, oh yeah, 20 have died today. It's not news. Those are mothers who will never be known. So that is really the story in Uganda today. And for each of those mothers who dies, you have hundreds, thousands who get life-threatening complications.
And that may be the biggest untold story of East Africa's painfully high rate of maternal mortality. Mothers who survive the experience but live with brutal and often serious medical conditions. It was something we saw firsthand when the Crossroads Give Life team accompanied our partner on the ground to hear these women's stories.
Of course, she said she lost her child.
We met a lovely mom who was so heartbroken because not only did she lose her baby because she had obstructed labor, her uterus burst, she had some of her intestine taken out, and she was going to have a colostomy bag, which may or may not be permanent. And it's really hard to imagine how that would impact the life of a mom. She already had 4 other kids, already living in poverty.
Azita's story broke our hearts because there is no easy answers for her. As is the case for so many women in Uganda, she came to a hospital overwhelmed and under-equipped. But she also came much too late to save her baby or her health.
And certainly equipment is needed, so sometimes there's times where we need to raise money for equipment. But if the woman doesn't even get to the health clinic, because in her culture, women are supposed to fight the battle of pregnancy. They're supposed to fight for their delivery. And when you go off to battle, some people come back alive, some people don't. And it's accepted as being normal. Then people have a different attitude and they act differently based on those beliefs and on those belief systems.
Dr. Jean Chamberlain-Froese is a warrior in the battle against maternal mortality. As a Canadian obstetrician, she spends 8 months of the year in Uganda working to change those belief systems. Crossroads is partnering with her organization Save the Mothers in a program that helps equip local hospitals to save the lives of mothers and babies.
Well, the Mother Friendly Hospital initiative was really started out of the recognition that we need to also change the social, cultural issues within the hospital, the way the mothers are being treated. Mothers need a safe and dignified delivery. Often women will actually deliver either at home or with a traditional birth attendant. And the traditional birth attendant, she has them deliver in her home, which is really like a hut, very dirty situations. She'll often use a razor blade that she's used for somebody else. She's a very kind woman, will give you a cup of tea, but she'll also give you these herbs, and they can end up actually causing a woman to lose her baby and to die herself.
Changing these customs involves much more than just telling women they need to involve medical professionals in their delivery. It also means transforming the hospital into a place women would want to go. The Honorable Sylvia Sinabulia is a member of parliament who advocates for safe motherhood in Uganda.
Deliveries at health facilities has been as low as 49% in Uganda. And when you try to find out from the mothers, why don't they come? They say, no, the hospitals are not welcoming. The nurses and the midwives are rude. So this project aims at to see what are the little things that can be done. It can be as small as a broken tap. And then you find that the hospital does not have water. And yet we know that water is so crucial to the whole process of giving birth and caring for the new mother. And sometimes it's just about a word of thank you to the midwives, to know that someone is appreciating their work.
And that's been the genius of the Mother Friendly Hospital initiative, working with health professionals to turn the experience around for both patients and employees. From improving conditions with new beds, painted walls, or much-needed equipment, to listening to health workers and addressing their concerns, the program is making a significant difference. a change they've seen in the increasing number of moms seeking care.
I've just been amazed to see the response of the health workers. Sure, they had the technical skills that they learned in midwifery school, but how do we make this place client-friendly? They know the social and cultural issues that keep mothers out. So I think it's been really neat to see how they've gotten on board and how their own attitudes have changed. They feel like they're part of this team of people that are trying to save the lives of mothers in Uganda.
The most heartbreaking aspect of East Africa's dying mothers is that most of the causes are easily preventable. Crossroads is committed to making a difference in this fight. Will you join us? No child should lose its mother when the solutions are so very accessible.
But you know, we're in a global community. I could accompany you from your local airport and come here to Uganda in less than a day. And to think about in less than a day of travel, there is a mother who is dying of a preventable pregnancy complication. We are all part of one world, and that mother is the mother of somebody who really needs her. Just like when you think about your own mother, you think about what a loss it would be if you had grown up without a mother. So I think all of us as a global community can think of how important it is for each one of us to help mothers in East Africa.
If you want to help give life to mothers, please go to our website at crossroads.ca and join the fight.